Let's start with some Viva question. Acute and chronic pancreatitis. Acute and chronic pancreatitis Viva question. A general question. What is acute pancreatitis? What is acute pancreatitis? Sir, acute inflammation of the pancreas due to premature activation of digestive enzyme. Acute inflammation of the pancreas due to premature activation of digestive enzyme. What are the most common cause of acute pancreatitis? What are the most common causes of acute pancreatitis? Gallstone and alcohol consumption. Gallstone and alcohol consumption. Next question. What is the pathophysiology of acute pancreatitis? What is the pathophysiology of acute pancreatitis? Sir, premature activation of trypsin. Premature activation of trypsin lead to pancreatic autodigestion and inflammation. Premature activation of trypsin lead to pancreatic autodigestion and inflammation. Next question. What are the classical symptoms of acute pancreatitis? What are the classical symptoms of acute pancreatitis? Sir, severe epigastric pain radiating to the back, nausea, vomiting and fever. Severe epigastric pain radiating to the back, nausea, vomiting and fever. What are the Cullen and Gray Turner sign? What are the Cullen's and Gray Turner sign? Sir, Cullen sign periumbilical ecchymosis. Cullen sign periumbilical ecchymosis. Gray Turner sign flank ecchymosis. Indicate hemorrhagic pancreatitis. Gray Turner sign flank ecchymosis indicate hemorrhagic pancreatitis. Next we will have Viva on topic of diagnosis and management. First question. What is the most specific enzyme for diagnosing acute pancreatitis? Question. What is the most specific enzyme for diagnosing acute pancreatitis? Sir, serum lipase more than 3 times normal. Serum lipase more than 3 times normal is most specific enzyme for diagnosing acute pancreatitis. Next question. What is the role of ultrasound in acute pancreatitis? What is the role of ultrasound in acute pancreatitis? So detect gallstone as an underlying cause. Detect gallstone as an underlying cause. Next question. What is the best imaging modality for assessing complication of pancreatitis? What is the best imaging modality for assessing complication of pancreatitis? Contrast enhanced CT scan. Contrast enhanced CT scan. What is the Ranson criteria used for? What is the Ranson criteria used for? Sir, Ranson criteria used for predicting severity and mortality in acute pancreatitis. Predicting severity and acute mortality predicting severity and mortality in acute pancreatitis. What is acute pancreatitis? How acute pancreatitis managed? Supportive care NPO, nil per oral, nothing by mouth, IV fluid, pain control and antibiotic. So supportive care NPO, IV fluid, pain control, antibiotic if infected, necrosis. Now we have Viva from complication and chronic pancreatitis. What are the complications of acute pancreatitis? What are the complications of acute pancreatitis? Pancreatic pseudocyst, necrosis, abscess, ARDS, multi-organ failure. So complication of acute pancreatitis is pancreatic pseudocyst, necrosis, abscess, ARDS, and multi-organ failure. What are the risk factors for chronic pancreatitis? Risk factor for chronic pancreatitis: alcoholism, smoking, genetic mutations, CFTR, PRSS1, and recurrent acute pancreatitis. Alcoholism, smoking, genetic mutation, CFTR, PRSS1, and recurrent acute pancreatitis. What are the classical symptoms of chronic pancreatitis? Chronic epigastric pain, weight loss, steatoria, and diabetes mellitus. What are the classical symptoms of chronic pancreatitis? Chronic epigastric pain, weight loss, steatoria, diabetes mellitus. What is the chain of leg appearance in chronic pancreatitis? ERCP finding of dilated pancreatic duct. With restriction. What are the surgical options for chronic pancreatitis? Pancreaticojejunostomy, Puisto procedure, Whipple procedure for head involvement.